Hello, you are welcome. Okay, so today we are discussing tonsillitis. But before, let's look at what tonsils are. So we are saying tonsils are a mass of lymphoid tissue. A mass of lymphoid tissue comprised of small almond-shaped bodies situated at each side of the pillar of the fauciate forces. So the tonsils are a mass of lymphoid tissues. Okay, so now these tonsils uh, they are made in form of a ring, okay, called the Wade's ring. So the Wade's ring, we're saying, is a collection of subepithelial lymphoid tissue of the pharynx. It is mainly distributed beneath the pharyngeal mucosa and are called tonsils. Okay, so the Wade's ring consists of the following. Okay, so they are number one, palatine tonsils. So these are the common tonsils that people usually refer to. Palatine tonsils. So these are situated in between the anterior and posterior pillars of each side of the oral pharynx. So those are the palatine tonsils. These are the common ones that people usually refer to when they say someone has got some tonsillitis. Then number two, we have nasopharyngeal tonsils or the adenoid. Okay, so the adenoid, this lies at the junction of the roof and upper part of the posterior walls of the nasopharynx in the midline. Okay, so these are adenoid or nasopharyngeal tonsils. Okay, then number three, we have the tubal tonsils. So tubal tonsils, these are found in the fossa of the Rosenmuller behind the pharyngeal opening of the eustachian tube. So these are tubal tonsils. Okay. Then we have the lingual tonsils. So when you hear lingual, it means tongues, tongue. Lingual, tongue. So lingual tonsils. So these are found on the upper surface of the base of the tongue. They are continuous with the lower ends of the palatine tonsils. So together, the palatine tonsil, the nasopharyngeal tonsil, which is the adenoid, the tubal, and the lingual tonsils, they make a ring, which we call the Wade's ring. Okay, so here is a diagram. Okay, here is a diagram. Okay, so we have the adenoid there. Okay, the tubal tonsils, the palatine tonsils, the ones that are common, these are the palatine tonsils, and the lingual tonsils. Okay, another diagram. Okay, so yes, showing the adenoid. This one in yellow, showing the adenoid. Okay, or the pharyngeal tonsil. Okay, and this one in purple, showing the tubal tonsils. And the palatine tonsil, this one in blue, and the lingual tonsil in green. So this is the Wade's ring. Okay, the pharyngeal tonsil or the adenoid, the tubal, the palatine, which are two, this side, and the lingual tonsils. Okay, so now, what is tonsillitis? So tonsillitis is the inflammation of the tonsils caused by Streptococcus hemolyticus, characterized by fever and pain. So there can be different definitions. All right. So what are the causes? So the causes, they are either viral or bacterial. Okay, so the virus, we have got the parainfluenza, the adenovirus, the rhinovirus. Then also bacteria, we have Streptococcus hemolyticus, the Haemophilus influenza, the pneumococcus, the Moraxella catarrhalis, and many more other causes. Okay, so now let's come to the classification of tonsils. What are the classifications of tonsils? So we have the tonsillitis. Okay, tonsillitis. So it occurs due to viral infection of the upper respiratory tract involving the mucosa of the tonsils. Okay, number 2, we have the cryptic tonsillitis. Okay, so following a viral infection, secondary bacteria supervenes and get entrapped within the crypts, leading to localized form of infection. Okay, and the third one is acute follicular tonsillitis. So the inflammation is spread from the tonsillar crypts to the surrounding follicles. Okay, the surface of the tonsils appears irregular with crypts filled with yellowish white exudates. Okay, then we have the fourth one, which is the acute parenchyma tonsillitis. So following viral infection, the immune status becomes low. Therefore, bacterial infects the crypts and rapid spread to the tonsillar parenchyma. Okay. So now, before we go to the grades of chronic tonsillitis, let's just look at the diagram which shows inflamed palatine tonsils. So these are the tonsils. Remember, the normal one is this one. These are the normal tonsils. And these are the ones now that have been inflamed. All right. So let's go back to the grades of chronic tonsillitis. Remember, tonsillitis is a long topic. So I've just tried to make it short. Otherwise, it has acute and chronic. So the grade 1 of chronic tonsillitis, this is where the tonsils are congested but are located within the tonsillar fossa. Grade 2, the tonsils are hypertrophied till the brim of the tonsillar fossa. Grade 3, this is where now the tonsillar hypertrophy extends beyond the pillar but does not touch each other. Okay, number 4, grade 4. We are saying the tonsils are in contact with each other. These are what we call kissing tonsils. They kiss each other. Okay, so what are some of the signs and symptoms? Okay, so there will be fever. A patient will present with high temperature. There will be general body malaise. Okay, there will be odynophagia. Then there will be also tender jugulogastric lymph node. Okay, should be lymph node there. Then there will be also be halitosis. Will be there. Then there will be also sleep apnea. So, what investigations are you going to do? Okay, so these are some of the investigations that you are going to do in case you are suspecting that someone has got tonsillitis. So number 1 is a throat swab for culture and sensitivity. You can also do a peripheral smear to rule out hemopoietic disorders. You can also do the X-ray of the nasopharynx so that you rule out adenoid hypertrophy. You can also do a computed tomography, the CT scan, to rule out adenoid hypertrophy. Okay. So what treatment are you going to give to a patient that has tonsillitis? So the treatment, there is medical and surgical. So in medical treatment, you can give antibiotics. That is, you can give phenoxmethyl penicillin, which is commonly known as Pen-V, which can be given QID. I won't put the dose because the dose, it depends with the age and the weight of the patient. You can also give amoxiclav, that is a combination of amoxicillin and clavulanic acid. Remember, these ones are given per oral, so this one can be given BD. Okay, then erythromycin QID can also be given. In case this tonsillitis persists, benzathine penicillin can also be given. Remember, this one is given IM only. Okay. Then you can also include, because of the pain and the fever, you can put analgesia or antipyretic like paracetamol, which has both, in order to relieve the pain. In case the pain is too much or the patient is not improving, you can give other analgesics. Okay, so now there's something that we need to take note of, is that in viral tonsillitis, antibiotics may not be needed. They may not work well. Okay, then there's a surgical treatment. In case the medication is not working well, the patient is having some difficulties in breathing. As you can see, maybe the tonsils are kissing each other. You can do a tonsillectomy or an adenotonsillectomy. Remember, before you do a tonsillectomy, you need to make sure that the adenoid is not also involved. Because if the adenoid is involved, you can do a tonsillectomy, then later on you find that the patient is still having some of the symptoms that they were experiencing when the palatine tonsils were enlarged. Okay, so no wonder it's very important, before you do a tonsillectomy, you do a CT scan to rule out adenoid hypertrophy. What are some of the complications that may arise? Okay, so there could be a peritonsillar abscess that we call a quinsy. You can also have tonsillorin, some stones may be formed, some tonsillar cyst, also rheumatic fever, and many more complications that may arise. Okay, so now remember, this channel is not a substitute of school and the hospital. You can study more, research more. Okay, until next time, bye bye.